Dear students, greetings from Dr. Hemamalini Jayachandran, Principal Vale Nursing College, Wales University, Periyapalayam campus. Let us see the very important and life-threatening condition called as postpartum hemorrhage. It's very important to safeguard the woman, especially during the postnatal period. Let us see what is postpartum hemorrhage. As we said, it is an obstetrical emergency and it is characterized by excessive bleeding or severe bleeding immediately after the childbirth. People say it is a leading cause of MMR, that is maternal mortality rate. Currently, it is accounts for 88 per 1 lakh live birth. Mainly 75% it contributes for postpartum hemorrhage. We'll see what is the exact definition. The definition of PPH is often based on the volume of blood lost within the first 24 hours after the delivery. If the blood loss exceeds 500 ml during the normal vaginal delivery, it is called as postpartum hemorrhage, whereas the blood loss exceeds 1000 ml during cesarean section, it called as postpartum hemorrhage. Let us see how the American College of Obstetricians and Gynecologists defines postpartum hemorrhage as the cumulative blood loss, at least 1000 ml it must be there, and also there must be accompanying the hypovolemic shock irrespective of delivery mode. It can be cesarean section or it can be a normal delivery, but blood loss of 1000 ml with the hypovolemic shock within 24 hours, they are terming it as postpartum hemorrhage. It is not normal. If the mother is at home, she needs to take care immediately. It is an emergency. It is not normal. Okay, let us see the classification. There are always the major classifications are primary and secondary. If the hemorrhage occurs within 24 hours following the childbirth, it is called as primary PPH. Secondary PPH, if the hemorrhage occurs after the 24 hours within the puerperal period, it is called as secondary PPH. And let us see what may be the reason for the postpartum hemorrhage. Let us see it as a mnemonic. 4 T's you can remember so that you can prevent this at the earliest and safeguard the mother. First T is tone, second T is trauma, third T is tissue, and fourth T is thrombin. If the uterus is very much relaxed, if the tone is not exactly and the mother goes for uterine atony, there will be a heavy bleeding after the childbirth. And during the delivery, if there is laceration, and definitely it will lead to bleeding and hematoma. So second is trauma, if there is injuries during the childbirth. And third is tissues. That means if the placental products or membranes are left inside after the delivery of the baby, definitely that bit does not allow the uterine to contract. That leads to postpartum hemorrhage. It does not allow the uterine to contract, so that bleeding will be very heavy. And the final T is thrombin. If there is any coagulation disorder, definitely mother will throw in for postpartum hemorrhage. So far we have seen what is the introduction about postpartum hemorrhage, what is the statistics says about PPH, and what is the exact definition ACOG says about the PPH, and also what are all the 4 T's regarding the etiology we understood. If there is any doubt, definitely pin me. We will discuss in the next class. The next class surely will talk about the management and the nurse's role. Thank you all.